Hey Psych2Goers, we hope you're doing well and are finding time for self-care. Now let's begin. Depression is the most commonly diagnosed mental health condition. But did you know that the term depression can refer to multiple different diagnoses? Depression comes in many different forms and affects each person in different ways, leading to multiple classifications. With that, let's look at a few of the most common types of depression. Number 1, major depressive disorder, clinical depression. According to APA, major depressive disorder, otherwise known as clinical depression, is a depressive disorder characterized by persistent low moods, loss of interest in your favorite activities, and a lack of motivation to carry out basic tasks. MDD is the most common form of depression, so when someone says that they've been diagnosed with depression, they're likely referring to this condition. Some of the most common symptoms include feeling low energy all day, even if you've had a proper amount of sleep, feeling like a burden on others or having a low self-worth, difficulty concentrating and making decisions, sleeping too much or too little, loss of interest or pleasure in activities, especially ones that you normally enjoy, recurring thoughts of death or suicide, and significant weight loss or gain. Symptoms of MDD must be present for at least 2 weeks in order to be diagnosed. Number 2, persistent depressive disorder or dysthymia. Persistent depressive disorder, PDD, is a depressive disorder similar to MDD, except that it is long-lasting. The symptoms of PDD are similar to those of major depression, but often fewer and not as intense. They include the following: low mood most of the day and almost every day, loss of enjoyment in once pleasurable things, a major change in weight or appetite, insomnia or excessive sleep almost every day, being physically restless or run down in a way that is noticeable to others, fatigue or loss of energy almost every day, problems with concentration or making decisions almost every day. These symptoms must occur for at least 2 years to be diagnosed. Number 3, bipolar disorder. Bipolar disorder is a group of mood disorders in which symptoms of mania and depression alternate. The DSM-5 has 4 different classifications for the conditions. Bipolar I disorder is where the individual fluctuates between episodes of mania and major depressive episodes or experiences a mix of these. Bipolar II disorder is when the individual fluctuates between major depressive and less intense manic episodes, known as hypomania. Cyclothymic disorder is recognized by periods of milder depressive episodes and hypomania. And lastly, other forms that do not fall under the categories of the previous types. The dramatic periods of high and low moods in bipolar disorder are often unpredictable and can sometimes occur at the same time in mixed episodes. These episodes may occur over weeks, months, or even years. Symptoms of mania, or the highs: excessive happiness, hopefulness, and excitement, restlessness, rapid speech and poor concentration, making grand and unrealistic plans, becoming more impulsive, less need for sleep, and a lack of appetite. During depressive periods, or the lows, a person with bipolar disorder may have depressed moods, lack of energy, not enjoying things they once liked, trouble concentrating, inability to feel pleasure, trouble making decisions, needing more sleep or an inability to sleep, appetite changes that make you lose or gain weight, and thoughts of death or suicide. Number 4, seasonal affective disorder, or SAD. Commonly known as the winter blues, seasonal affective disorder is a disorder in which there is a predictable occurrence of major depressive episodes, manic episodes, or both at particular times of the year. The typical pattern is the occurrence of major depressive episodes during the fall or winter months, but in some cases can occur in spring and summer. People with SAD typically sleep much more than usual and crave carbohydrates. They also have many of the normal warning signs of depression, including feeling sad, cranky, or hopeless, less energy, trouble concentrating, greater appetite, increased isolation, and thoughts of suicide. Number 5, postpartum depression. Sometimes referred to as baby blues. Postpartum depression is a depressive episode that affects some women within 4 weeks to 6 months after childbirth. According to Mayo Clinic, postpartum depression signs and symptoms may include depressed mood or severe mood swings, difficulty bonding with your baby, withdrawing from family and friends, loss of appetite or eating much more than usual, inability to sleep or insomnia, or sleeping too much, fear that you're not a good mother, feelings of worthlessness, shame, guilt, or inadequacy, severe anxiety and panic attacks, thoughts of harming yourself or your baby, and recurrent thoughts of death or suicide. Number 6, premenstrual dysphoric disorder, or PMDD. Premenstrual dysphoric disorder is an unusual disorder in women that begins the week before menstruation begins and subsides within the first few days of menstruation. The symptoms must be severe enough to impair functioning in social activities, work, and relationships. Symptoms of PMDD include lasting irritability or anger that may affect other people, feelings of sadness or despair, or even thoughts of suicide, mood swings or crying often, lack of interest in daily activities and relationships, feeling out of control, and physical symptoms such as cramps, bloating, breast tenderness, headaches, and joint or muscle pain. Number 7, atypical depression. Atypical depression is a major depressive episode characterized by features that are unusual in other forms of depression. Most commonly, your depressed moods improve significantly when you hear good news. A person with atypical depression may experience sadness or depressed mood most of the day, but improves when something positive happens, loss of enjoyment in once pleasurable things, a major change in weight or appetite, insomnia or excessive sleep almost every day, feelings of hopelessness or worthlessness or excessive guilt, problems with concentrating or making decisions almost every day. And number 8, psychotic depression. Psychotic depression is a subtype of major depression that occurs when a severe depressive illness includes a form of psychosis. The psychosis can take forms such as hallucinations, seeing or hearing things that aren't there, delusions, having false beliefs, or some other break with reality. Common symptoms for patients who have psychotic depression include agitation, anxiety, hypochondria, intellectual impairment, physical immobility, delusions, or hallucinations. Did you find this video insightful? Let us know in the comments below. Now that you know some of the different types of depression, it's important to know that depression in any form can be extremely hard to handle. If you are struggling, please reach out to a qualified mental health professional. Getting in touch with the right person can help you get your life back on track. Be sure to like this video and share it with anyone you feel will benefit from the video. Make sure to subscribe to Psych2Go and turn on notifications to keep up with our uploads. Thanks so much for watching and stay tuned for the next video. Take care.